Well, I'm joined now by Dr. Emad Bakar, who's based at the Al Ali Hospital here in Doha. Nice to have you on the programme. The global numbers for diabetes are quite horrific over the last 3 decades, if they've doubled so much. Most reason is given that the general population is either ageing or they've reached middle age and they are more susceptible to diabetes. But it's not a disease, as we saw from the map, that's concentrated on just the rich countries.
Correct. Correct. As you mentioned earlier, it's also related to the new lifestyle. I mean, the new lifestyle, obesity, and the type of fast food that has been currently eaten by everyone, lack of physical activity. That's one of the factors that has contributed recently to the increase of diabetes figures and numbers. But when you talk about diabetes, also it's good to remember that we have different types of diabetes. So we have the children diabetes, the adult diabetes, the pregnancy diabetes. So it's not, I mean, there are different types, different categories. Factors.
Just very briefly, how much of a problem is it here in the Gulf?
Well, it has been, I mean, I don't have the accurate figures, but it has been said that if you look at the adult age and you take a cross-sectional view, you might find up to 50% or more of the population touched by diabetes, which is a huge number.
There's a huge amount of research involved in creating drugs to help combat the disease. You can never cure it, apparently.
Right.
$13 billion, WHO estimates, that could rise to $17 billion by 2015. Are there too many drugs on the market? I mean, what do you prescribe? I mean, what sort of drugs are we looking at?
Yeah, I'll go back to the beginning of question that you said you might not be able to cure it. We don't know. We hope that cure can come with the genetic engineering. I mean, you lack insulin or your cells do not respond to insulin. This is the basic problem of diabetes. If science can help you produce the insulin, help your cells to respond to the insulin, you might really reach the cure. And there are lots of research going on about giving you the pancreas cells, implanting the pancreas cells, and cure might happen in the future. It can happen. Regarding the medications, it's an enormous amount of medication, and they change. Insulin was first introduced in 1929, and before that there was no cure. Before that, no pregnant woman with diabetes could have given birth to a living child. All the children of diabetic ladies would definitely die. So there is always an evolution of the production of medication to trying to combat the side effects which happen with them. And so in the market, there is a huge amount of medication. When you prescribe them, you try to correlate them to the type of diabetes you are dealing with and the general condition of the patient you are dealing with.
Okay, well, we'll see what does happen, certainly, and how this progresses in the coming years. For the moment, Dr. Bakar, thank you for joining us.
Thank you very much.
Thank you.